healing comes from God, and God has put all this healing into DNA, and the DNA lies inside the cell. So if we know how to heal the cells from the DNA level, we need to understand how the cells talk to each other, and HHA is the perfect tool in this. We understand that the body is comprised of many cells, and our own cell in our own body constantly is trying to communicate to the exterior, and the exterior situation is affecting our cell internally. So our internal cell harmony is directly affected by the external situation, and the external situation can directly harm or help our body inside. So how does a cell talk to the exterior? Okay, you see, when you talk about a cardiac cell, a heart cell, they constantly talk to each other using electrics. But when I touch myself onto the skin, I felt no electricity. But if I put a device onto the skin, like ECG, the ECG is able to detect this microelectric called microohms. So such an electricity from the cellular level is being conveyed onto the skin. So such a path is called meridian. Meridian is a pathway where the internal cells trying to send the mail, the messages out onto the skin. So meridian refers to the outflow path from the internal cell to the skin. Whereas the Chinese physician use acupuncture. Acupuncture is where on the skin, the certain area on the skin and the point on the skin, there is actually lower resistance in electricity, and the acupuncture point is the inward point. So the outflow and the inflow. So the outflow of the cell talking to the skin is actually meridian. And in our body there are many meridian paths. Okay, all these meridian paths trace back into the 12 organs in our body. So in Chinese medicine we believe in 5 element studies. We group our internal body into 6 groups, 6 internal organs and 6 external organs. They pair up like brothers and sisters, like a football team, okay, like a soccer team. 12 soccer players work together for the common good of the team. So in our body has 12 organs, and every 12 organs is grouped into 6 groups, and every 6 groups there is a nerve and a pulse that represent them. They actually travel to the skin. Okay, so by using a device, checking the electrical impedance onto the skin, one is able to pick up the internal information from the skin, just like how an ECG pick up the information from the heart cells. Okay, so in HHA devices, in HHA practice, we have a device that take the microohms, microimpedance onto the skin. We take 6 points from each limb. So that is about 12 points from the left body and the 12 points to the right body. We feel pulses all time for patients. Imagine you have 24 physicians touching your pulse, analyzing your body, and after they analyze your body, they sit down and they have a conference, and they come up with a plan and they write it on the paper. This is how accurate HypoHealth Alert is. It's about 24 doctors, different doctors from 48 dimensions, studying your body, coming up with a conclusion and a plan, and tell you everything onto a paper. And they don't just focus into drug treatment, but they give you holistic advices. And they give you great advices like exercising, balancing your body, and focusing on all those areas that we have been neglecting all throughout our years of life. So I found out that this is a very neutral device that can provide neutral opinions, that it forced me to work with other experts in the medical field and the non-medical field or the alternative field. And we no longer work as Lone Ranger, but we were united by this device called the HHA. And all of us, when we unite our expertise, the only one person that can be benefited from this whole thing is the patient itself. We understand that if you are a smart doctor, you would try to learn how to heal a patient while the disease is still early. There's no glory in curing a patient that is end stage. You see that? So for me, throughout my years of practice as an allopathic doctor, I was forced into a situation that most of our patients is late, and I don't like that. To be honest with you, I don't like to have many sick patients. So I forced myself to learn and to start my own quest for real healing. As I venture into learning what real healing is all about, I started to understand that I need to change. My thinking needs to change. My practice needs to change. I cannot work alone anymore, and I have to partner up with many other alternative therapy, physiotherapy, and many other healthcare experts. So we have to adopt a new holistic, balanced healthcare team, multidisciplinary team, so that we can deliver the best healthcare solution to those people who are interested to heal themselves. I have come across a patient who's so afraid of needles that he wants no blood test to be done and no urine test to be done. And if such a patient go to allopathic doctor, there's no way that the doctor is able to do an effective treatment. I myself, using a HHA device on this patient, I am able to find out many wrongs in the life situation, the lifestyle, and also many disturbances in their cellular level and the tissue level. So what I did was I go according to the plan that is suggested by the HHA report, and also tailored into the healthcare daily programs for the patient, and I add in my own expert advice and expertise, and we have successfully helped this patient to walk out from the hypohealth situation. And we also have serially document this cellular healing. If we continue to use HHA, we are able to solve many problems that the traditional medicine would not be able to solve. HypoHealth Alert System is a perfect tool. We can even zoom in down to the percentage of disturbances of the white blood cell, the white blood cell activation, and we can even zoom into how antioxidants work, in our body. How much antioxidant level in our body. These are some of the very good features in HypoHealth Alert System, the HHA system. Sometimes the blood test is 2 to 3 months older than the HHA report. So HHA report is able to encourage a patient to go through further treatment, therapy, when we are able to document cellular healing and tissue healing, which is the early healing that one might not be able to feel it yet, but the cell actually is healed. Some of the heart attack patients, after 3 to 4 months, when you draw their blood, the enzyme is not high even. That doesn't mean that they do not have a heart attack. So HypoHealth Alert can review what is masked and what is hidden, and what is chronic, and what is being hid away in our body. It is able to tell us the real disease and the root cause of the disease and the origin of the disease, so that we can plan a holistic healthcare plan for the patient, tailored to the patient. The HypoHealth Alert device is focusing on how much the reserve is being used, rather than just the disease is happening. Allopathic tests focus on how disease is progressing. HypoHealth Alert System is focusing on how much organ is being disturbed. So it is entirely two different investigations. Both can complement each other. It is not contradicting at all, but it can help to complement and supplement each other. HHA is recommended for 6 years old and above. 6 years old and below, if you want to do it, you need to learn how to interpret the report as according to the clinical history, and also correlate with maybe blood tests or maybe ultrasound, maybe other tests. So HHA is not a very limiting investigation tool, but it warrants you to look at all other areas of the patient's life, and also all other alternative investigation that you have. Our dreams and goals one day is to be able to share our experience in HypoHealth Alert System around the world with many healthcare practitioners and also people who really care about healing the body inside out. If you are one of us, please let us know so that we can help you to prepare yourself, to help you to launch the Herbal Health Alert System so that you can form your own wellness team or a holistic healthcare multidisciplinary team to work together and to use this system to be able to deliver the real-time healing, the real cellular healing to all your patients so that all your patients can enjoy real healing and to enjoy the real life that God wants us to live.